Hey guys! Today, we will discuss about handling a prescription. Are you guys ready? Let's start now. Handling a prescription. Following procedure should be followed by the pharmacist while handling the prescription for compounding and dispensing. 1. Receiving. 2. Reading and checking. 3. Collecting and weighing the material. For compounding, labeling and packaging. Receiving. The prescription should be received by the pharmacist. While receiving a prescription, a pharmacist should not change his facial expression as it can give negative impression to the patient. Reading and checking. After receiving prescription, pharmacist must have to check whether it is written in proper format or not. A prescription should always screened behind the counter. In case of any doubt, pharmacist should immediately consult the other pharmacist or doctor. Collecting and weighing the materials. Before compounding the prescription, all the materials required for it should be collected on left-hand side of the balance. After weighing all the materials, it should be sifted on right-hand side of the balance. While compounding label of every stock bottle, it should be read at least 3 times to avoid any mistake. Compounding, labeling, and packing. Only one prescription should be compounded at one time. All the materials required should be suitably cleared and dried. After that, the compounded medicament should be suitably labeled and filled/packed in appropriate containers depending on its quantity and use. Thank you for watching. If you guys really learn through our channel, then don't forget to like, share and subscribe.